Welcome back to Out in Life Live. You know, the doctor is in the house. Our friend, Dr. T with the Doctors of Waikiki is back on the couch sharing how his clinic offers primary care and urgent care daily, including on the weekends. Mahalo, Dr. T, for joining us. And for those who don't know, share what Doctors of Waikiki offers. Can you let everybody know what you guys offer?
We offer urgent care between 8 a.m. and 10 p.m. every day, and primary care between 12 and 8 p.m. every day.
You know, I've been to your folks' clinic before.
Really? Oh, I
really
remember.
Nice. You remember?
Yeah.
Because I used to live in Ala Moana, right?
Yeah.
And I gotta say, it is so convenient. The parking is awesome. Your staff is very friendly.
Thank you, thank you.
You know, and I remember I went in with the flu one time, and I mean, the wait time was maybe like 30 minutes. And even though there's a lot of people, it was so efficient and so quick.
Thank you, thank you. Well, we try.
Do you folks accept all insurances?
We accept all insurance. We accept travel insurance. We accept Medicare, Medicaid, you name it, we accept it. Aloha Care, Quest, come on in.
Wow, everybody, yeah?
Everybody.
And what makes the Waikiki spot so special?
You know, what's special about it is we're trying to cater to the community in Waikiki and the surrounding area. And that's why the primary care is being offered at from 12 to 8. Get in before work, get in after work, which is unique because most primary care offices do a normal 9 to 5. So this way we can kind of fit into your needs. You don't have to leave work. You can actually come in and get care. And then if you need urgent care, you just walk in anytime.
Yeah, and I've been there many, many times. And you know, there's a lot of locals that also work in Waikiki,
Correct.
right?
There's a lot of locals that work in Waikiki. My guesstimate is about 80,000 to maybe even 100,000 work in Waikiki. About 40,000 people live in Waikiki.
Wow. Okay, so let's take a look at some of our viewer questions. Okay, question number 1. Makakao, doctor. How would I know I have diabetes? Wow.
Wow. Well, one easy way, and how most, well, that's not an easy way. Most people, they don't know they have diabetes, but they'll start having these symptoms that might be diabetes. One of them is they start drinking lots of water, eating more because they're very hungry or they're very thirsty. And then they'll notice that they're going to the bathroom a lot of going shishi a lot. That's another one. And then losing, unexplained loss of weight, because what the body does is trying to make sugar for the brain, so it'll start to burn fat. And if the diabetes is not controlled, you'll lose weight a little bit as well. So all those are findings of diabetes. There's other more specific ones, but that's probably the key. Okay,
that is good to know. And what is the difference, the next question over here, what is the difference between pre-diabetes, type 1, and type 2 diabetes?
So pre-diabetes we try to catch so that we can give people changes in their lifestyle or give them medications that are safe to kind of not get diabetes. So pre-diabetes is where your test that we do for diabetes is below 5.7. I'm sorry. Yes, that's 5.7 is the cutoff. But if it's diabetes above that, and the problem then is you're dealing already with a lot of the health problems related to diabetes. And so type 1 is usually born with. You end up getting it later in life. It's many reasons why we think that happens, maybe because of the body and it's immune related, but diabetes type 1 seems to be very serious because of how it presents. People get really sick. But type 2 is usually the most common type that we see.
Right.
People who, as they get older, they have predisposition for this. They didn't really take the best of their care of themselves, and they end up developing type 2 diabetes.
Wow. Okay, we got a next question over here.
That's a lot, though. Diabetes is a big subject.
Yeah, and this next question comes from Hunger Brought. Okay, he says, I love plate lunches and beer and Haagen-Dazs ice cream. Can I still consume these food and beverage if I have diabetes?
Everybody loves Haagen-Dazs and beer.
Right.
And plate lunch.
And mac salad.
And mac salad.
Gravy all over.
But if you have diabetes, you need to take into account that the more you put in, the more problems you're going to have related to your diabetes. So you got to at least manage your diet a little bit better, meaning less, maybe 1 to 2 beers max a day, or maybe even less than that a week. And then look at your carb intake. So if you're having plate lunch, that means rice, mac salad, and probably another carb on there, and then the meat, right? So you got to 1 scoop of rice is about the maximum you should do a day.
Wow, 1 scoop of rice.
1 scoop. And then the ice cream, leave that.
Yeah.
That's like once a month, maybe have ice cream.
And you know, locals love rice. What's your take on rice?
Rice is good. Brown rice is better,
okay.
but still it's a carb.
Right.
I tell everyone it looks like ice cream.
Yeah.
It's ice cream. It's all sugar.
Yeah, and you know, diabetes is prevalent amongst the Native Hawaiians, the
Correct.
Polynesian population as well.
Why is because the introduction of foods from the West,
Right.
that kind of changed the whole dynamic for the Polynesians because they were not accustomed to those types of foods, and I think that's the biggest problem. Everyone needs to go back to old school.
Old school.
Yeah.
That's why I like to eat a lot of poi and fish. Yeah.
Poi and fish is much better for you than anything from McDonald's or Burger King or Pizza Hut.
Thank you so much for being a
you're
part
welcome.
of Island Life Live. We've got all the information right here on our screen, of course. We'd like to welcome you back again next week.
Sure.
Thank you for educating.